Anyhow, supraspinatus strengthening, empty can versus full can. I believe it was Neers, talked about the empty can as a good test for a good isolation of the supraspinatus for testing integrity and as a strengthening exercise. Won't argue with him. Knows a whole lot more than I do probably about the shoulder. But we now know maybe that's not the best position to test and to strengthen. So EMG, indwelling EMG suggests that similar EMG recruitment in the empty can as in our full can. Okay? So, well, what's the big difference? So with our empty can, we're internally rotating, pulling tension into our posterior cuff, which may yank on that scapula. We may get a little bit of that anterior tilting we were talking about from the scapula. So making the subacromial space smaller. Yeah, I just get sore hanging out here for a few minutes. So pulling the tension in the cuff, and then also we take that greater trochanter, or greater tuberosity, and that starts to move forward and starts to get into a smaller position and approximate into the acromion. So we're at double disadvantage there. And then, okay, so we just start going, we keep jamming into it. Okay. We may want to eliminate that, particularly because EMG says same here as here, but up here, we're not getting that posterior cuff tension. We're not pulling that greater tuberosity anterior or superior as we internally rotate. Also, we're thought to have higher deltoid firing in the empty can position. What is deltoid going to do? It's going to cause a superior vector. So now we get an increased superior vector in addition to the smaller subacromial space before we even move to the arm because of being in this position. Okay. Again, won't ever argue with him. Probably knows a whole lot more about the shoulder and did a whole lot more than I ever will for medicine in terms of rehabbing the shoulder. But we might rethink, is that the best option at this point? Okay. Another good recruiter is prone full can or prone horizontal abduction at 100 degrees. And that's also not only a good supraspinatus, but may start to pull some of our scapular stabilizers into play. Infraspinatus and teres. Optimal exercises are sideline external rotation, external rotation with a TheraBand, and prone external rotation at 90. Let's look at the TheraBand one here for a moment. Put the towel in there. Okay, the towel, EMG studies suggest that putting that stupid little towel in there causes an increase of 20 to 25% muscle firing. Okay, so another one of those little areas where I think we can tell the patient, hey, put the towel in there. It's important. They look at, do I really need this towel? So they think they can do it this way. And then maybe the towel is helpful because if the towel hits the ground, you're starting to cheat. But whatever it may be, I would tell them, put the towel in there. If you're going to spend your time, let's maximize it. By putting that towel in, you're going to have 20, 25% more motor firing, which in turn is going to be a better exercise for you. Okay, so you might want to throw those numbers out at them of why they want the towel. And same thing, when they come in the clinic and you review it, make sure you take the extra moment to put the towel or a wedge or something in there other than, okay, let's just do our external rotation. Okay. Prone external rotation at 90 may not be where we start, but we may progress to that aspect of things. Okay. And that would be because of the potential capsular integrity if we have any stability issues. Subscapularis, okay, internal rotation and 90 degrees of abduction. Good position. However, potentially, if there's other issues, is a position of less stability as compared to down here. But when we're doing our internal rotation down here, we may be getting overpowered by some of our pecs or our lats. Up here, we don't have that occurrence quite as much. But again, this might be something we progress to. It may be difficult to start up in this position right off the bat. But both good EMG recruiters. Also, diagonal exercise. So coming down, this is a good multi-purpose exercise, not just subscapularis. You're pulling a lot of dynamic scapular stabilization and control into it as well. Okay. Also consider good EMG signal with the dynamic hug and the push-up with the plus. These aren't our highest subscap recruiting exercises. However, we can only ask our patients to do so many. These are good scapular exercises, so our pushing forward at the end there. And I meant to send them out before when we did some of our leg stuff for practicing the bands with our squats, but I have a couple bands up here. And we think about our dynamic hug, and this is where it's good to have a group of physical therapists to hopefully help me do them right. And I recognize that I do a little bit of an error here. So the dynamic hug is, we're here, sort of like a push-up with the pluses. At the end, we try and protract our shoulders forward. And I feel sometimes when I do it, I need to be aware that I'm not over-firing that upper trap. And you can see I'm kind of exaggerating it, but we'll often see that as over-firing of the upper trap as we're trying to do it. So we need to coach or instruct, let's keep those upper traps out of it as much as possible. And I catch myself, when I demonstrate it sometimes, I catch myself, oh, there's those upper traps again. So I really stay in tune to the patients of making sure we don't over-fire those upper traps. And those are fine-tuning things that maybe we argue, does it matter, does it not matter? I mean, maybe we could argue that. It takes you 10 seconds to kind of cue that. So I think if we could make it a little bit perfect and it's that simple, we might as well be doing it.